The pelvic floor is the only muscle that's 100% against gravity, and it is an interesting complex that is connective tissue and striated muscles that simultaneously counteract gravitational forces. They deal with inertia and intra-abdominal pressure. Meanwhile, it supports all the positions of your pelvic organs. And in 30% of women, injury or failure of these pelvic floor muscles cause pelvic organ prolapse. This is why women who have EDS have a higher rate of prolapse, because their connective tissue is looser. Surgical treatments have a high reoccurrence because, well, we have a limited understanding of how the pressure of the pelvis works. We need to understand how we can change the loading conditions of the pelvis to help prevent pelvic organ prolapse and restore normal support. And I, as your women's health physical therapist, will tell you strengthening your pelvic floor so you have less leaking, improved control so you have less SI joint dysfunction, because your pelvic floor is really important for a lot of things. But I know you don't want prolapse. So listen up, keep following. So since 30% of women experience prolapse in their lifetime, your vaginal tissue happens to get injured because it has a lot of risk because of your age, birth trauma, chronically straining because you have constipation. Of course, they mention obesity, but and there are other risk factors such as EDS and connective tissue dysfunctions. And because of our not educating women on their pelvic floor, what to do to support it, roughly 12.6% of women will seek surgical treatment for their symptoms of pelvic organ prolapse and other pelvic floor symptoms. And an estimated 40% of these will experience a recurrence within 2 years. And this is why, if you have a pelvic floor dysfunction, I am telling you to find a women's health pelvic floor physical therapist, someone like me, to help you figure out what is going on with your pelvic floor. Do you have weakness? Do you have hypertonicity, which is too much tone, and you have pain? Are you leaking? Do you have pelvic organ prolapse? Because I don't want you to suffer, because surgery has a high rate of failure. But here's why I think surgery has a high rate of failure. Imagine sewing together a t-shirt quilt. Sewing t-shirts together is like the most stretchy, frustrating fabric you could ever think of. That is what pelvic floor surgery is like. So I want you to know that the things that I'm recommending are general, and I am a PT, but I am not your PT. But there's a lot of women's health physical therapists out there that can help you, and we have direct access in all 50 states. So you can go and find a PT like me and schedule your appointment and figure out what you can do to support your pelvic floor.